Welcome everyone, Dr. Morse here again. This is going to be the 6th episode of the Eternal Vitality Podcast. We've covered all different types of topics, from peptides to testosterone to PRP to why America's healthcare system is broken. And now we're going to talk about something that's not really super commonly discussed, but I think is very important and deserves some attention. That is not only depression, which unfortunately is very prevalent in today's society, but also something that has been studied for many years, but not ever really considered mainstream, at least in my opinion, from a traditional medical professional, and that's ketamine. Now, I have a nurse practitioner here that works with me in our office in Miami. This is Kate. Kate, will you please introduce yourself?
Hi, I'm happy to be here. Thank you for having me. My name is Kate Yeadaker. I'm a holistic nurse practitioner, specialized in family nurse practitioner program. I've been in NP for 9 years. I mostly work in integrative and functional medicine, and in addition to that, for the last 4+ years, I've been working in the ketamine space. Started off initially in an in-person clinic, ketamine clinic, moved to working for a company that provided at-home ketamine lozenges for people. I've worked in all different settings with ketamine and done a lot of extensive training regarding ketamine-assisted psychotherapy and the like. And I'm very passionate about using ketamine as a tool for healing and for powerful transformation and the treatment of depression, PTSD, anxiety, etc.
Welcome. Yeah, so this is way over my head. I don't know a whole lot about this, so I needed someone that is much more informed than I am. So this will be an interesting discussion. Starting with ketamine, it actually was found in the late 50s, early 1960s, and it's actually originally derived from PCP, believe it or not, angel dust, quote unquote. But when they realized that angel dust itself was way too strong and had way too many side effects, they started working more and more in the lab, and they came up with ketamine. Now, they initially called it, eventually they've learned to call it the dissociative psychedelic, and it has been able to reliably produce pain control, forgetfulness, intoxication, and disassociation and euphoria. As I said, it originally started in the 1950s in Detroit. Eventually, they were looking to find the ideal anesthetic agent for anesthesia, and then it was synthesized in 1962 by a Calvin Stevens, who realized that it had an excellent anesthesia and it was short-acting. They started human studies in 1964, so this is not a new drug. This has been around way before any of your traditional antidepressants. And it was initially described by patients as feeling of floating in outer space and having no feelings in their limbs, which is a pretty significant statement. And that's why it was classified as a dissociative anesthetic. Clinical trials around the world began in the 1970s. France was one of the sites that was doing, and then it was a potent analgesia, but it was less potent and less shorter duration than PCP, which is why they chose to use it. It was approved by the FDA in 1970, and it was used to help soldiers in Vietnam. So they used to help, a lot of, I'm sure, PTSD and some of the other unfortunate issues that they're mentally going to go through because of all this stuff that they witnessed. Now, we saw the rise of propofol as an anesthetic in the 1980s, which saw a decrease in the use of ketamine. So there's a give and take. And then there was, you may or may not know about this, there was people started abusing ketamine after 2 books by a woman, Marcia Moore. Have you ever heard of this? Apparently they were describing all types of euphoria, and as a result, people wanted to feel that euphoria and started kind of doping with it, and it got a little bit of a bad rap from that, but that's uncontrolled and unfortunately got a little bit of issues with that. In 1999, it was classified as a class 3 controlled substance. And at this time, or for the past several years, it's been added to palliative care, which is end-of-life care, to help people die peacefully. And its use in therapy has kind of changed and evolved. There was an English psychiatrist by the name of Dr. Jansen that suggested that under medical supervision, ketamine could be used to treat certain mental illnesses, which is where it kind of sits now. Now, in 1980, it was discovered that ketamine activates the NMDA receptor, which is a glutamine and methyl D-aspartate calcium channel, which is responsible for its plasticity properties, and she's going to talk about that later because that's one of its biggest benefits. Ketamine does have a non-competitive inhibition to this receptor, which is why it has the properties it has. It can be used for at the time, it was recommended it can be used for hyperalgesia, schizophrenia, and any mental functioning issues. But it became evident that memory, thinking, and consciousness were the result of the synaptic plasticity, which was what was influenced by the NMDA receptors. Now, at this point in time, and you can talk about this in a little bit, and this will be the main subject of this, it's now being used to manage treatment-resistant depression. There were tons of studies, have been tons of studies, and many of them were proven by Berman et al. And Kudo et al. That low-dose ketamine possessed an antidepressant activity, and that's part of the reason why they like to use it. Now, compared to other antidepressants, which take weeks, sometimes 6, 8, 9, 10 weeks to act to what we call to get to a steady state, which basically means the blood levels are high enough to actually have an effect in the body. Ketamine can start within a few hours. I've seen data as fast as 40 minutes, which is pretty insane. Yeah. And I'm assuming that's probably correct. There's a bunch of Harvard studies and a bunch of Harvard articles on ketamine. A couple that I looked at, one of which was specifically discussing treatment-resistant depression, and they said which is severe depression that has not improved with several other therapies, and includes people experiencing suicidal thoughts. There was over the past couple of years, maybe 5 years ago or so. So in 2009, the FDA approved a prescription medicine called esketamine or Spravato, esketamine, and it's a nasal spray. Now, the problem with this med, from what I understand, and I'll have you chime in a sec, is that the guidelines are very specific, which is good, but this has to be used in a controlled environment with a doctor. Right. So even though it's a prescription, it's not really a prescription, it's more so like a treatment, because even though it's a nasal spray, you have to do it under the controlled setting of a physician, so it's a little bit misleading in my opinion. Oh, we have this prescription available, but it's not really a prescription. It's just approved as a therapy. What are your thoughts on that?
Well, you touched on a lot of topics. So first, I'd like to say that ketamine does have many neurobiological benefits, and the data for that is very strong. It increases BDNF, it causes NMDA receptor antagonism, and currently there's a lot of advances in the field of psychoneuroimmunology that have shown that they've elucidated that there's a relationship between inflammation and the development of major depressive disorder and treatment-resistant depression. So ketamine, in addition to all the benefits that you already outlined, also provides some anti-inflammatory effect on the brain. And so there's a lot of thought that also contributes to a reduction in active suicidal ideation, and just in how robust and rapid acting ketamine can be for people who are severely depressed. Specific to the types of different ketamine, the nasal spray, you're right, that's given in the office, usually with a psychiatrist. However, the way that people take it when it's given IV or IM is usually given to promote a more mystical or psychedelic experience. And so ketamine, although it is a robust antidepressant, has all these numerous neurobiological benefits, it also provides what we call a psychedelic or mystical experience, and in that experience people are able to process a lot of the underlying factors that have contributed to their depression. Like, let's say, for example, we treat a veteran. I've treated many veterans over the past several years who have PTSD and depression. It may not be enough to just treat them in terms of their neurotransmitter function, right? Because that doesn't address underlying traumas associated with being in war, visualizing, violence, having nightmares, etc. So that's one of the most unique things about ketamine, is that it provides the dissociation of an experience where you can sometimes revisit trauma without that emotional activation. You're disassociated from your body, you feel like you're floating, and you're able to look at things from more of what we call a zoomed out lens or a zoomed out perspective. And that experience in and of itself, coupled with all the neurobiological benefits, is what really offers people an incredible opportunity to not just treat the symptoms of depression, but to treat a lot of the root causes of depression, PTSD, and anxiety.
Beautiful. We're going to go into a little bit more stuff in a little bit about your experiences with patients. I'm going to add a couple more kind of studies, because I use this podcast as not only a way to share information to people, but I also want it to be a resource for providers, whether they're a doctor, a nurse, mid-level, whatever. It doesn't, at whatever level you're at, I want you to utilize the information, because I spend probably 4, 5, 6 hours researching this stuff. So this isn't just off the top of my head. It's pulled in with studies. There's a lot of time that goes into this, but that also means that it is research backed, and it's not just my feelings and thoughts about certain things. So, in terms of the Spravato, the nasal spray that was approved in 2009, the studies showed that it helped depression scores in the short term. And one of the things to note, that most of the patients that were on the studies were actually on an oral antidepressant at the same time.
Right.
And then the long-term people, it helped them, using this regularly, helped them to stay in stable remission for over 16 weeks, which is a decent amount of time. It is important to note, at least at that time, that ketamine is not a first-line option for depression. And that may depend on who you ask, but at least that was a statement they were making at that time. Right. Ketamine was found very effective in treating depression. Harvard Magazine, Harvard Gazette, released something at the end of May last year, 2023, that showed a study that came out in New England Journal of Medicine in June of 23, that 403 patients from Mass General Hospital in Massachusetts found that 55% of them who received ketamine experienced a substantial improvement in depressive symptoms without major side effects.
Yep.
Now, if you talk, I'll comment on that in a sec, but compare this. The goal of one of the studies was to compare ketamine to ECT, which is considered the gold standard for depression, or at least one of the gold standards for non-psychotic treatment-resistant depression. Now, the ketamine was considered non-inferior to ECT for treatment-resistant major depression without psychosis. That basically means that it is equal to it. Therefore, you can choose either. And if ECT is considered the gold standard, then therefore ketamine should also be considered in the same light. Now, I found that kind of fascinating. Whether it is a financial thing, a big pharma thing, or whatever it is, that's where it starts to get a little sticky. But ketamine's value, its safety in anesthesia and anesthetic management have been demonstrated for over 50 years and on thousands of patients. There's no question it's safe under the right environment with the right patient if you know what you're doing.
Correct.
Sometimes they still use it, to my understanding, in anesthesia cases.
Oh, every day.
You know,
on children.
Yeah.
I mean, it's really safe.
And I believe I read something that certain parts of the world, that's all they use. Maybe that's all they can get. Maybe that's all they can afford.
Right.
So there's surgeries being performed with just ketamine as an anesthetic, to give you an idea of how potent it can be if done. You know, you have to, for those patients that get it IV, you have to monitor vitals and other stuff.
And that's a much, much larger dose.
Yeah.
Yeah. So, sorry.
No, but I thought that was fascinating.
Yeah.
There was one other study that you actually sent me this morning, posted on Dr. Michelle Wiener's Instagram, and she's down here in South Florida, it looks like.
Right, and she's a very well-respected physician who treats chronic pain and pain disorders, and has been working with ketamine also for several years.
So the study that she had recently presented was from about a month ago, February 12th, 2024, by Chen and De Leon from Translational Psychiatry, and basically said that the brain's opioid system plays a role in ketamine's antidepressant effects. And they realized that blocking the opioid receptors with naltrexone actually nullified ketamine's antidepressant behavior in rats. And they found that specifically when they directed this toward the medial prefrontal cortex in the brain, that was really where everything was happening. So ketamine treatment increased the beta endorphin levels in this specific part of the brain, and then there was an expression of a gene called the POMC in the hypothalamus, which helped to confirm that ketamine, or at least greater suspicion that ketamine actually stimulates the beta endorphin release. Now, you just handed me another one a little bit ago that I haven't really had a chance to look at yet, but the title is Ketamine for Acute Treatment of Severe Suicidal Ideation. Pretty much tells you all you need to know with the headlines. And in general, I think, you know, the data is there. You know, in terms of...
The data is strong, the data is there, and anyone who's worked with ketamine knows very well how effective it is.
Now, I did plenty of psychiatry when I was in residency, but I haven't really touched any of it since, because it is definitely a challenging field in my opinion. Where does this stand in general psychiatry? Where do people, you know...
Well, there's mixed views, obviously, about it. I think that right now there's a renaissance, there's a psychedelic medicines renaissance that's occurring in the United States and beyond and all over the world, where you're seeing a lot of phase 2 clinical trials for psilocybin, for MDMA, for the treatment of trauma and depression. So a lot of the younger generation of psychiatrists are really following this new data that's emerging and just seeing that psychedelic medicines really have a lot of promise for the future, tend to have a lower addiction profile, they're helpful to treat addiction, and they found in a lot of these studies that people have more long-term results. So it kind of runs, you know, you run the gamut of people who are more traditional psychiatrists who believe in just prescribing more antidepressants. Then you have the whole field of integrative psychiatry. Now, integrative psychiatry does what we do, which is integrative medicine. So they're looking at what are the other factors that influence depression, gut health, HPA axis dysregulation, so hormonal imbalances, inflammation, microglial inflammation in the brain. So they're looking at it more from that perspective and that lens, micronutrients, you know. In integrative psychiatry and integrative mental health, we do a lot of supplementation with omega fatty acids, and there's even studies that have been shown that supplementing people who are experiencing acute suicidal ideation with just DHA and omegas can help to decrease some of their suicidal thoughts. So I think there's traditional psychiatry, there's integrative psychiatry, and then there's this, you know, this burgeoning field of psychedelic medicine, and that's where you find a lot of the people who work with ketamine. So, you know, in the Bay Area, in the Northeast, there's a lot of providers who are psychiatrists who kind of moved away from the traditional model of antidepressant prescribing and have moved and incorporated more ketamine into their practice, and they do ketamine-assisted psychotherapy. So what you find is these psychiatrists and a lot of psychotherapists work in conjunction with them will dose a patient in the office, and then the patient is allowed to process and have this psychotherapeutic process about the ketamine journey, about the experience they had. And in doing so, they're able to resolve a lot of, whether it's childhood trauma or relational trauma or, whatever it is that's contributing to what's causing their symptoms. They're able to work through this in a safe container, in a safe space. And I really want to emphasize how important that is. When you are going to take ketamine or you're seeking out a provider, you want to make sure that this person is really looking out for your safety, that consent is involved, that you feel like your needs are being met and you're being respected. And also, when we take a psychedelic medicine, there's a concept of set and setting, which I think is really important. Bringing intention into the experience. What is my goal here? What do I wish to gain? What do I wish to let go of? And then the physical setting and the environment, making sure that it's safe, that you won't be disturbed, that you're surrounded by supportive, loving, and helpful people, and that you're surrounded by people who know what they're doing, who understand what to do in case there would be an emergency. I luckily, thank God, have never experienced an emergency with ketamine. But all those things are really important. So I always like to stress that for anyone who may be considering ketamine, you want to make sure that all of those things are checked off on your list.
So tell me, what are the different forms?
So there's oral lozenge, which is probably the most accessible in terms of the economic factor because it's not as expensive. But the bioavailability is not the best. It's like anywhere between 18 to 23% if you take a sublingual lozenge. There's IV and there's IM, both of which obviously the bioavailability is, the maximum. You're absorbing 99, 100% of the ketamine into your system at a very rapid speed. And so those options exist more in the more medical clinic settings where people go to get ketamine. A lot of psychiatrists will give IM injections of what they call a psycholytic dose, which is a lower dose of ketamine, so that the patient, although they're very relaxed and sedated, they're able to still talk throughout the process. Other ways of administration are the ones you mentioned, nasal spray. Some people do suppositories, but I think what's the most widely used right now is either IV administration, IM administration, or the lozenge. And the lozenge is a lot less expensive for people, and so that's why it's become a more popular option for people.
Now, when you say less expensive, what would be, say, a standard IV rate for what you know?
So we're in Miami.
Yeah.
I think most clinics will charge anywhere between $500 to $600 for one infusion.
Okay.
And most clinics will treat people with 6 infusions.
So ends up being $3,000-4,000.
So
Miami's a little bit more expensive, so maybe you back that off. New York, LA, probably similar. So, but in terms of like middle, if you can find it, middle of the country or not a city, you're probably going to get a little bit of a cheaper thing that gives you a gauge. In terms of price for either injectable and lozenge, is this something that they can just buy over the counter? Can they buy it? Can they get it from the pharmacy? Like, how does one? Because I'm going to get this question, so let's answer it before we get it. How do people get this? If you were to say, hey, they live in Colorado, how would someone get this? Who would they find? How would they search this?
They would obviously search probably online for a ketamine provider nearest to them, and then go from there. Whether they choose and decide whether they have the resources to do IV experience, or whether they want to take the psychotherapeutic route, which I'm a huge advocate for. Obviously, the IV and IM route is more expensive. There are companies that provide at-home ketamine services, which is lozenge, and ketamine is, Schedule 3. It's a controlled substance. You have to have a DEA number in order to be able to prescribe it. Not anyone can just prescribe ketamine, nor should they. And the provider that's prescribing ketamine for you should be doing a very detailed intake and assessment of both your mental health history and your, physical general health, especially in terms of cardiac conditions. Ketamine can increase heart rate and blood pressure, mostly blood pressure, and so we're always very mindful of that. Causes, transient increase in it. So we always screen people appropriately, especially you want to make sure that patients are not on too many sedating meds. You want to hold stimulants or sedatives concurrently on the day that you're taking ketamine. So it's important to have a provider who's well versed in the ketamine space, who understands what ketamine may or may not interact with, how to prepare you for the experience. That is huge. So it's important to have a provider who knows how to prepare you for the experience and how to support you with integration after the experience. That is really, really important. So I want your listeners to hear my voice in their heads and find a provider who understands what the experience is like. There's a lot of providers out there giving ketamine. They've never had experienced ketamine. They don't know what it feels like. They don't, you want to find someone who is very experienced with ketamine, who knows how to explain to you what it's going to feel like, what you're going to experience. And not only that, you do have profound experiences, or what people call the ineffable type of experiences that people are unable to even put into words. They're unable to even articulate what they saw, felt, visualized in that space. You need to have support to integrate whatever insights you gained, whatever wisdom you gleaned. You need to have support integrating those things into your life post-ketamine experience. So if we approach this work, we have to approach it responsibly and mindfully, and prepare people both before they go into the ketamine journey and afterwards. That's really important. So for whoever is considering it out there, you want to make sure that any place that you seek out for ketamine, that this place provides that for you. Also, that the music is, very calming and gentle, that your eyes are covered, that you've been fasting for at least 4 to 6 hours beforehand. All of these things the preparation is really important.
So you don't just wing it.
Nobody just wings it, and you never should. And this isn't something that is to be done as an afterthought. This is something that should be done with a lot of planning, a lot of careful planning, a lot of intention, as I mentioned beforehand. Intention is really important when we take a psychedelic, and proper follow through, so that the integration can be cohesive, so that you can bring the changes that the ketamine has brought to life for you, so you can integrate those changes into your life. And that's where you find the beauty of ketamine. I mean, I've treated patients who, oh my God, I've hundreds of stories, but I've treated patients who have been able to give up alcoholism, who maybe didn't even admit to me that they were alcoholics initially, but have told me, all of a sudden I have no desire to drink, I have no desire to smoke cigarettes, I have no desire to gamble, etc. And it's very helpful for addictive behaviors. People who were depressed, but now they've taken up guitar lessons, they're riding their bikes every day, they're going out on dates, they're able to make the changes in their life that maybe when they were severely depressed, they couldn't even fathom integrating these changes into their lives, right? Yeah. But then they had the ketamine, and we talk about diet, we talk about inflammation and the role of inflammation and depression. And then they're more open to saying, hey, you know what? You're right. Maybe I should change, modify my diet. Maybe I should eliminate XYZ. Maybe I am going to start, maybe now I have the energy to start working out again. So it helps you to really bring in positive changes into your life. And that's one of the benefits of the neuroplasticity, because ketamine increases BDNF. So you have this neuroplastic window, and in that window where these neuroplastic changes are occurring, that's when you try to bring in the most positive changes. So I'm always encouraging people to journal daily. daily meditation practice, exercise, learning a new instrument, learning a new language. You know, the more you put your brain to work in that period, the more lasting changes you'll have in the long term.
So one of the things I wanted to stress is that depression is very prevalent, as I mentioned earlier. You know, some of the studies I have written down here, I think it's 21 million in the U.S. alone. It's probably way more than that, in my opinion.
Oh yeah.
But it's probably 10%, if not more. Especially post-COVID, with crazy inflation rates, politics. Like, if you live in Miami, you can't afford anything unless you're a multimillionaire. It's ridiculous. Like, there's so many barriers, so many things. Gen Z is really struggling in particular. So depression is unfortunately, in some capacities, can be quite prevalent. Now, what we've experienced with traditional antidepressants, whether it's your SSRIs or any of those, the rate limiting factor for those, there's a couple things. One of which is they are very slow onset. I'm talking 6 weeks, 8 weeks, and people who are really depressed don't have 6 weeks or 8 weeks. You know, and another thing that a patient told me, that multiple patients, but this one in particular, told me that when they were on an SSRI, they felt like they were like on a cloud.
Yep.
And like they had like a sheet over them, like in front of them, or I don't know how to describe it, but that's how they told it to me. I've never taken one, so I don't know how it feels, but and it was almost like they were like sleepwalking almost.
Numb. So yeah, I would like to speak to that. So I've you know, done hundreds and hundreds and hundreds of intakes for ketamine, and I will say that invariably across the board, people who've been on antidepressants for a long time have a lot of side effects, sexual side effects, their libido is decreased. And they'll say to me, this was a common theme that I observed. People will say, well, yeah, I don't feel as depressed, but I also don't experience joy. Like the highs that happen for me, I don't experience them either. I feel numb. So numbing is a term that would come up often for people who are on antidepressants, long-term use of antidepressants, where they're just kind of going along with their everyday lives, but they're lacking this maybe sense of a deep sense of meaning or a deep sense of fulfillment, and that is what is profoundly impacted by ketamine. I mean, just my experience alone have helped a lot of people wean down off of antidepressants with the help of their psychiatrists, and have seen people get off of them for good and do really well. And you know, again, it's like just like what we talk about in integrative medicine is root cause medicine, really looking at what's contributing to the depression. And now studies have shown that this whole concept of neurotransmitter dysfunction was really not necessarily legitimate after all, and that people aren't necessarily lacking in these neurotransmitters. They likely have experienced a certain degree of trauma in their lives, and they likely have never explored that trauma in a safe therapeutic setting. And so ketamine allows people to get to the root of why they were struggling in the first place, in addition to all the other neurobiological benefits that it provides. It really, it's just, honestly, it's such a comprehensive medicine. It's,
you know, I spoke with one patient and who had fantastic success with ketamine, and the reason why they were kind of falling into it was because they were in a deep depression, and they had a lot of suicidal thoughts. It was a dark time for them. They didn't have a whole lot of physical, you know, support, and they had been on antidepressants before, and it just didn't do much for them. They were kind of like, you know, walking aimlessly and numb, so to speak. And you know, they're like, I don't, you know, every day is eternity. Like, this is the longest day of my life, and 8 hours feel like days.
Right.
So it was like there's no way they could fathom starting a new antidepressant 4 or 6 weeks later. Like, I probably won't be here in 4 to 6 weeks to wait for that time period to happen.
Right.
So thankfully they were able to get an IV infusion or a series of IV infusions of ketamine in a controlled environment, in a very controlled setting. You're on blood pressure monitors. There's heart rate. There's a bunch of moving parts. These patients, I'm assuming it fits into what you say as well. They have to go through a blood urine tox screen for other drugs to make sure they're not on anything, and they have to make sure that they're safe to do this. Usually this is a psychiatrist doing it. I guess anesthesia would technically fit into that, but it's usually psychiatry from my understanding. And for this patient in particular, they had fantastic success, went 3 times over a course of a week, so basically Monday, Wednesday, Friday, we'll say. And each one's probably what, like an hour for the IV ones, maybe an hour and a half, something like that. So we'll say 3 hours. Over the course of 3 hours of treatment, they were no longer suicidal.
Yeah.
That's incredible.
Yep, and it's not uncommon.
And that's how crazy potent in the right, with the right product, with the right dose, with the right provider, with the right guidance, it can be this potent. Now, unfortunately, it may not be available to you, whether it's financial or just physical where you're at, but I want people to be aware of this and understand that just because traditional medicine doesn't talk about it doesn't mean it doesn't work.
Correct.
It doesn't mean that it's not available.
Correct.
I liken this to the PRP and the stem cell stuff that I inject every day.
Absolutely.
Just because big pharma is not a big fan of it, just because insurance doesn't pay for it doesn't mean it doesn't work. It works great.
Absolutely.
It's just access to care and understanding that it's available. So one of my favorite phrases is you don't know what you don't know. So I'm introducing something that maybe you've never heard of before, or maybe you've heard of but didn't really think much of it. Or maybe you are depressed. Maybe you have someone that your loved one is severely depressed and you want to help them. And we just introduced a new potential game changer for you. That is the goal, whether you're here in America or anywhere around the world. That's the luxury of the content that we have the ability to provide nowadays. Is that I get comments from people, whether it's my injury stuff or this or whatever, Turkey, like literally all over the world. I don't even know where they are half the time. But that's the beauty of what we have the potential to do to impact. So that was my primary goal for this. Wrapping up is how often, obviously it depends on the situation, but for someone who has depression, what would be the initial evaluation and like how often would they do this? Like so, it's not a daily thing from my understanding.
No, definitely not. We would never want people to be taking ketamine daily. That could lead to dependence, obviously, intolerance. Usually the way that ketamine is given to treat depression is 6 doses over a span of 2 weeks, plus or minus. So usually they'll do 2 infusions in 1 week, spaced out by about 48 to 72 hours, and then continue with another 2 infusions, and then they can space it out a little bit further after that. People who are in the at-home model, I noticed, just because of time constraints and working and children, etc., they tended to take it sometimes twice a week, sometimes once a week, because it takes a lot of time. Like I said, there's a lot of preparation involved. However, how it's been traditionally studied has been in 6 doses over a span of 2+ weeks. And then usually there's a period there where we, reassess the patient. A lot of times practices will do the PHQ-9 scoring, GAD-7 scoring, Columbia Suicide Risk scoring, and then compare these scores to where they were at their baseline. And then from that point, you can reevaluate whether or not you think the patient should continue with maintenance, if the patient feels like they need to continue with maintenance dosing. And that kind of is person to person specific. I encourage anyone who is going to venture on the path of taking ketamine to combine it with psychotherapy. That is the way to have the best results possible. And a lot of times what ketamine can do with the rapid and robust antidepressant effects in that initial period, once that's kind of resolved, then the rest of the work comes in with the therapist, and that continues on for weeks, if not months, if not years. So I like to always remind people that ketamine is a tool. It's a tool for your transformation. It's a tool in your toolbox. And the more that you commit to doing the work and showing up for yourself, and whether that's therapy or meditation or exercise or diet or supplements, etc., the more this tool is going to give back to you, and the more profound, long-lasting results you're going to have with it. But each person, it's very individualized thing. So no two people are exactly the same when it comes to dosing, when it comes to what their experiences are like. There's some common themes and commonalities of, you know, I feel like I'm floating, I feel like I'm in space, I travel through landscapes, I see loved ones who've passed away, etc. But no two people are exactly the same, and equally so, treatment approaches after that initial period vary based on the person, their needs, what other meds they may or may not be taking, their lifestyle, etc. So that's why you always want to have someone who prescribes it responsibly and who takes into account all of those factors, and someone who hopefully advocates to doing ketamine in conjunction with psychotherapy to reap maximum benefits.
Perfect. Last question. If you were to say this ketamine is particularly helpful for the following conditions, what would you say?
Depression. Treatment-resistant depression. My personal anecdotal experience is PTSD. I have treated a lot of veterans, like I said, a lot of people who've experienced severe traumas in their life, childhood traumas, all types of abuse, child abuse, sexual abuse, rape, etc. And I've seen profound transformations in people. I have to say that I've been a nurse for 20 years, I've been an NP for 9 years, and no work I have done has been more fulfilling than the work I've done with ketamine, because consistently across the board, people got results and they felt better, and it works. And you know, that's something that we don't always experience, right?
Nope.
Especially not in traditional Western medicine. It's just kind of like people don't necessarily get any better. We're just treating them.
Yep.
But with ketamine, they do get better. They do get better, and you see them living fuller lives and happier, and they come back and their gratitude is profound, and they say, what's common for people to have shared with me is like, you've given me hope again. Like, you've given me hope that I could have, like, you know, a relationship again, or I could, you know, go out and get this job that I may have wanted. And so it's really inspiring work and really rewarding and fulfilling, because it works.
Hope is a powerful thing.
It works, and yeah, hope is a powerful thing.
So I hope that was helpful for you. And I hope that you share this with people that may be dealing with something or maybe fascinated in this topic. And, you know, if you haven't checked out some of the other episodes, check out some of them. There's clips all around the internet of pieces of each one. You can find them on, you know, YouTube, Spotify, Apple, wherever you'll be able to find it. We have a lot more coming up. I think next week I'm probably going to talk about a cool product and medication that we've been using for a couple of years, but that have been around for over 100 years, called methylene blue, which is an amazing drug that, you know, is really fascinating to talk about and very effective. So, you know, that'll probably be my next topic. But tune in, let me know what you want to hear. Let me know what topics you want me to discuss, whether I'm comfortable talking about it or I bring an expert like this situation to talk about it more. Thank you for tuning in. We will see you next week.